We've seen the largest surge of COVID-19 hospitalizations to date through the entire pandemic occur in the last couple of weeks. And we've signaled for the last several weeks that healthcare systems are close to the crisis standards of care. Yesterday, Monday, Labor Day, Kootenai Health brought forward a request due to the increase in COVID-19 positive patients that they've seen as recent as over the weekend. Like all hospitals across the state, they've faced staffing shortages. And as we announced last week, we have deployed additional resources, both from the federal and state level, to help out that have arrived over the weekend and will arrive this week. But even with those additional resources, it was still not enough to cover the current surge in patients. In addition, bed space is becoming very tight in North Idaho. Yesterday, Kootenai had their record high for COVID cases for inpatients, critical care ICU, and number of patients on ventilators. And we expect those numbers to increase over the next few weeks. Because of their situation, they've had to turn away transfers from other local hospitals in the region. As you may know, Kootenai serves as a hub for high-risk cases and highly complicated cases to go to them for services. They've just not had the capacity to do so. And as of yesterday, patients are now being boarded in a converted conference room due to the space limitations at the facility. Normally, regional hospitals across the border in Spokane would also be able to help out, but they are also full and unable to provide the assistance that they normally would. I'd like to thank Kootenai Health for everything that they've done to alleviate the resource constraints, and they really pulled out all the stops to find every way possible to alleviate the resource constraints. However, given their situation, they did make their request, which means we convened the Crisis Standards of Care Activation Advisory Committee yesterday afternoon late. And that committee, after a lengthy conversation with the requesting hospital, had a long conversation looking at all the data in the situation and did recommend that we activate crisis standards of care. Subsequently, I declared crisis standards of care for North Idaho and the Panhandle and the northern central health districts be activated. This means that hospitals there may implement crisis standards of care protocols. We will continue to work statewide to alleviate the situation, and we'll continue to monitor daily the situation and review options that we have. Some of you may be wondering, what does this mean for you, particularly if you live in North Idaho? What it means is, if you go to the hospital, you should expect a longer wait time. You may not be seen in a traditional space. In fact, you may be seen in a classroom or a hallway, or you may be sent to a different hospital that has more capacity. The situation across the state is not much better. And we're going to share a chart here for a minute of our hospitalization numbers across the state. And what you can see here is the top line is number of hospitalizations across the state. You can see that we hit a new high last week with a daily average census of 496 across the state for COVID patients in the ICU. We hit another record this last week with a daily average census of 154. And the bottom line there is ventilator use, which is at its highest level with a daily average census of 89. We expect, as I mentioned earlier, these numbers to get worse in the coming days and weeks. And the real answer for all of us is to choose to get vaccinated. And here you can see our vaccinated versus unvaccinated in the numbers. This is data from May 15th, when everyone in Idaho 16 and older was eligible for a vaccine, to last Saturday, September 4th. And here in these numbers, you can see the number of cases and how many of them were vaccinated versus unvaccinated. 90%, or 32,600 out of 36,200 cases, were from unvaccinated individuals. And I want to pause here and just mention that across the state of Idaho, we only have about 0.53%, that's less than 1%, of vaccinated people in Idaho who have had a breakthrough case of COVID-19. The vaccines are highly effective at preventing cases. You can also see that 92% of our hospitalizations, or 1,400 out of about 1,500, were from unvaccinated individuals, and 89% of our deaths, or 243 out of 274, were from unvaccinated individuals. I hope that your takeaway from this is that the vaccines work. They are safe and effective. They are the best tool by far that we have to prevent people from getting sick, and certainly to prevent people going into the hospital. For those of you that have chosen to be vaccinated, thank you. Your choice makes the difference for you and the rest of Idaho. For those of you that have not chosen to be vaccinated yet, please consider choosing to get vaccinated. For all of us, please wear a mask indoors and in outdoor crowded spaces. It's also a secondary tool in addition to vaccination that will help slow the spread, particularly as we feel this pressure on our hospitals. And then more generally, I would encourage all of us to just be a little more careful. Wear your seatbelt, take medications as prescribed, reconsider high-risk activities that could land you in the hospital, as that's where we are in terms of hospital capacity at this point.